Next on Primary Care, child mental health and COVID. For many Black children, challenges related to the pandemic have placed a considerable toll on their emotional and mental health. Hello and welcome to Primary Care, the show dedicated to improving the health of African Americans. I'm your host, Dr. Lonnie Joe. The COVID-19 pandemic has put a spotlight on children's mental health. While the physical effects of COVID have not been as severe on most children compared to adults, the mental health impacts of the pandemic are just as severe. Current research shows a surge in anxiety and depression among children and adolescents since the pandemic began. It was always a problem beforehand. What is it now? Given the disproportionate burden of COVID-19 on African American families and communities, the mental health and emotional health of Black children is a grave concern and is the focus of today's show. Our guest today is Patrice Lucas. Ms. Lucas is a licensed mental health counselor. She specializes in providing culturally specific counseling and creating safe, healing spaces for African Americans. She joins us to talk about the effect of COVID-19 and what it is having on the mental and emotional health of our children. Mrs. Lucas, welcome and thank you for joining us.
Thank you, and thank you for having me.
Patrice, what is the emotional toll that this pandemic has had on the mental state of Black children in our community?
Yeah, well, I think it's a grave toll that has taken place for children in our community. I think it's important for us to individualize that statement, though, and check in with the individual children. So there's a lot of impacts from, as you mentioned, depression, anxiety. There's more anger, social isolation, even shame has been coming up for a lot of children during this pandemic as we come into their homes with these videos and these cameras and those type of things.
You know, this problem in terms of mental health for children and adolescents, it was a pre-COVID situation that we did not have adequate resources. We did not have adequate attention being paid to this population. COVID has compounded that. What do you see as the current needs in terms of playing catch up behind this pandemic?
Absolutely. So access. We can play catch up by having more access, and intentionality. I think it's important that we are very mindful and intentional about the mental health of Black children and the Black community as a whole. I think we put specific intentions around physical health, but we still have not caught up to really the mental health parity that needs to exist, and making sure that when we talk about physical health, right after or alongside, we're talking about mental health.
You know, in a lot of arenas, we have applied the phrase PTSD in various ways. Now, recently, I'm seeing it being applied to the pediatric age group in a post-COVID type scenario. Are we experiencing some particular issues that are coming out of this pandemic?
Absolutely. So I'm very cautious to use the term post-traumatic post for African Americans, and especially African American children, and COVID. We're not post anything. We're not on the other side of it. Yeah. And so I think what we should be saying in that instance is that we are actively experiencing traumas, because I think saying it's post or using the language of post-traumatic disorders is implying that we're past the trauma. We're actively experiencing the traumas, and we need to address that current state.
What role do you see the parents playing? We know that the role is paramount in all of these issues with children, especially what we're up against now, but in particularly COVID and COVID-related issues. What role do you see the parents playing in the home? Are there any particulars associated with that?
Absolutely. So the parents are the children's advocates, and I would like the parents to advocate for their children's mental and emotional and physical well-being. And so that's the role they play. I think the biggest role that I would want to encourage parents to play is honestly acknowledgement. I think one of the biggest barriers to mental health for this pandemic is we haven't acknowledged the toll. I remember back March of last year when the school shut down, very quickly we ushered the children and pushed the children right back to school. I don't even think it was a full week. We haven't paused and really acknowledged the impacts to mental health. I'm still not seeing mental health, again, being intentionally highlighted or showcased in the schools or in the learning curriculum, et cetera. So acknowledgement and then advocacy for parents.
Right on point, absolutely. I think you're correct. We have not taken that pause to really identify and examine the scope of work that's involved with such a terrible situation. The patient themselves, the child, the adolescent, what kind of symptoms are they experiencing or exhibiting during this time frame?
So it varies from child to child, but they're exhibiting symptoms of behavior changes, but they are showing signs of sadness and depression. Again, I mentioned shame, which is kind of in there with the sadness and the depression. There's heightened anger for some children. I would also like to mention there's heightened fawning. So some children are, they're not on their best behavior because they're trying to be of help. And so that should be noticed just as much as, some of the behaviors that, we deem as more negative or less productive, right? So if your child is even being more helpful or trying to be on their best behavior, being really, really good and all that, you want to check in with them as well, because that is a symptom. That's a change in behavior. They're not fawning. They're trying to help and be on their best behavior to not be a burden or a stressor. And that should be addressed as well.
What should parents be looking for? We are hopefully paying attention all the time, but what specifics should parents be looking for that are signs or warnings that your child may be getting into trouble?
Well, trouble from a mental health perspective, we're looking at signs and reduction in functioning. So they used to function at this level and now they're functioning at this level. And so again, those changes in behavior. But here's the thing, again, with that pause that I speak about, or the intention or acknowledgement that mental health is going to deteriorate in a pandemic and under these conditions, I think it's not enough to just say, oh, we're going to have changes in behavior or functions. We should actually expect it. But when it becomes severe and you need support with the management and the correction of those function changes or those behavioral changes is when you seek the support of a professional.
That's very important. Everybody's busy, everybody's schedule is tight, and now that this increased pressure has been put on us, it's not fair just to push some of those things to the side and not pay even more attention to what's going on in the life of the child. Patrice, we're up against a break, but when we come back in our Black Lives and COVID series, you're going to hear from a third grade school teacher who had to find new ways to reach her students during the pandemic.
A lot of my students came in with a lot of fear and worry and concern.
Whether it's advice on managing your anxiety or tools to help you stay grounded, Coping-19 provides a range of resources and self-care tips to help you cope with this pandemic. We can help. Find the resources that work best for you at coping-19.org.
Welcome back. Today in our Black Lives and COVID series, we talk with Brenda Heath, a third grade teacher at Detroit Charles Wright Academy. As an educator, she was determined to get her students through the pandemic.
My students were very fearful at the beginning because of the culture, with everything. A lot of my students had lost a lot of family members to COVID, because COVID really hit this community very, very hard. And a lot of my students came in with a lot of fear and worry and concern. And so one of my concerns as being a teacher was to remove that fear, to take away that for that moment. Like at this space, this is a safe place, this is a good place. You're only here because your parents want you to be safe. And I'm here, you're here. One thing about it, we're all here. We're at home, you're at home, and we're not gonna let none of this stop us from attaining our goals of being successful and becoming winners. And so I told my kids, I had this tagline I told them, I said, we might be in a pandemic, but we're not gonna panic, okay? We're not gonna panic, we're in a pandemic, okay, yes. this is strange, this is new, but we together, we're gonna make it through. So every day, I would actually do a check-in. I check in every day. They use there because I had to find a way to reach them. That was my concern about being a virtual teacher, was how do I reach these children? How do I build community on a virtual platform? That was my fear of it, because I'm really big on community. I'm really very much in touch with my parents, my students. I'm really into that. That's everybody knows me, Mrs. Heath. I connect to my students. I connect with my parents. And that is one of my fear of virtual, was how do I build this connectivity? How do I build this community? And so every day I would check in. I check in with them, I would listen, I would share, I would give them an opportunity to share things. They would drop their emojis, And then we talked about COVID a little. We talked about what it is, what we need to do. I talked to them about, going out in the world, make sure you wear your mask, social distancing. We talked about what the virus was and things we can do to stay safe. So I actually made it real, and we connected to it, but we let them know it's not gonna be a barrier. And one of my little girls, she says, Miss Heath, I love virtual. And I said, what do you like about it? Because everybody else is going, I'm ready to go back to school. And she said, because no one can bully me. And for the first time, that really hit my heart, because she said, I feel safe. I'm at home, my mom is here, my little sister's here, and no one can bother me. And I never ever thought about it from her perspective, that, that for a child like her, she felt safe at home. She said, because usually when I'm at school, the kids bother me and they pick on me and say mean things. And she said, but when I'm here on virtual space, no one can do that to me. And she said, and that's what I like about virtual. And that particular day, that hit home for me. And I realized at that moment that, some people this platform works for. There's some kids who are thriving. I have kids thriving on virtual, not a lot, but I do have a few that really feel good. And I have parents who love it too, because they say they have less incidents with issues at school, and some kids do have issues with social emotional. But I also think about it too, I have another student where the parent says she's worried that her child is not making connections. And when we had our picnic the other day, the dad was saying she didn't want to talk with the other kids because she felt she didn't know them, because she hasn't really learned how to socialize anymore. And he said that was a concern because she's with them all the time. She wants to be under them. So we have to find a balance. I think there's a balance between that social emotional, because we need it, but the kids need to find a way that we can make it work so we can be able to thrive in the real world.
Patrice, Mrs. Heath said that she did a check-in with her students every day. How important is that for children emotionally, and should this be continued as students return to in-person learning?
I think this is a great tool, and I would honestly like to see it continued throughout the educational career of children. I want it to be incorporated into the schools. It sounds like it was a great help to the students, but also Mrs. Heath, she was able to know how to meet the individual or specific needs of her students and give them that grace and care that they need during this time.
When should parents, basically being the primary caregiver in the front line, when should parents be seeking services for their children, especially trying to head off any untoward effects that the children may be suffering from?
Absolutely. So I think parents, you seek services when you cannot meet the problem or address the challenge on your own. So when the parents need support and helping to elevate and uplift and maintain the health of the children. And so my encouragement is, particularly from a mental health and physical health perspective, I think preventative health is, kind of the way to go. We don't wait until we're in crisis to seek the support. Once we begin to see any negative symptoms is when we look to begin to see the support, but also kind of building that village. I tell my new parents and parents that I support in their children's health journey and their own health journey to build that village. So already have the resources and things in your toolbox. So when you need to tag someone in, you have that available to you. I think starting with their educators is a good way to do it, using the support tools that's available at the school, such as the social workers or the counselors is there, and then broadening that to other people in the community.
I like the concept of extending that circle. It's something we already do. It just hasn't been broad enough in the past. So when should primary care doctors, and particularly pediatricians, be reaching out, or families be reaching out to cooperate with you and the types of services you provide?
Yeah, it's back to that functioning. So when the child has a marked difference in their functioning and their day-to-day behaviors is when we should bring in additional support persons to really just get the child back on track and being able to have that life experiences, educational or otherwise, that they deserve and we want them to have. Again, I can't highlight enough that I think is important to note that there are going to be some functioning and behavioral changes because we are currently experiencing trauma. We're currently in a pandemic. And so those should be met with grace and empathy and compassion and an opportunity to kind of just, understand that our best right now is not the same as it was in 2019. And so that is part of it. But if there's a marked change in the functioning, in the child's behavior and support is needed, and that's when we should bring in additional care providers, including counselors.
In other words, parents pay attention.
Pay attention, but also give grace and empathy. Like, I think it's remiss of us to think that our children are not impacted by this pandemic. And so if you see your child having some behavioral challenges or some functioning challenges, that's when the conversation begins and the support begins.
Patrice, what has been the impact of COVID on teenagers' mental health? And I say that because sometimes teenagers are beginning to present a different set of problems simply because of their environment, the peer pressure. I mean, we're in a different world. It's not like when we grew up. It's a new day in terms of what we have to deal with in terms of teenagers. Has COVID brought any additional problems to that arena?
So for teenagers, they were just beginning their kind of independent lives. I have teenagers myself, a 15 and a 17-year-old. And so what COVID did was it really snatched them out of that budding life that was beginning. They were beginning to drive. They were beginning to socialize differently with their friends, having that really independent opportunities with their friends and their peers, go to the basketball games or the dances or the movies even. And all of that was taken away from them very abruptly. So it was almost like their lives just had turned on as teenagers, and this independent opportunity to kind of move in the world independent of their families. And then that was snatched away, and a lot of them came home from college or was back in the bosom of their families and really under a microscope in ways that they weren't before because they had more autonomy as teenagers. And all of that was snatched away. So the impacts to that was depression, anxiety, anger. A lot of the teens are exhibiting signs of anger. They're angry that they lost so much during this pandemic.
I had one patient tell me that when her daughter complained that she felt she was being punished by all of this activity around COVID, that was the first clue that she saw that my daughter was beginning to develop some depression. And being in such a high pressure society, I am sure that it has had more negative effects than that, especially on the teenage population. My dad used to say, once they ask for the car keys, you're in trouble anyway. So you're there at that point. What has been the barriers or the challenges to accessing service? We're talking about an age group and a population who in a community like ours was already short in terms of being able to get to the proper people and get the proper care. Now we had a pandemic on top of that. What have been some of the barriers that parents and patients have been affected by?
The biggest barrier has been availability. So we haven't talked enough about mental health practitioners being the kind of the invisible front line. My personal caseload, it just went out of control at the beginning of the pandemic. And I know my colleagues, we all are saying the same thing. There is not enough available, culturally competent, culturally specific clinicians to meet the need of the population. So that's a big part. So even when the clients are ready for care and they have overcame so many of the hurdles to get to care, including stigma and shame and lack of understanding of the mental health profession, then there's not clinicians necessarily available for them. So I think that's a really big hurdle. I mentioned stigma. Stigma is such a big hurdle for so many families, particularly with children and adolescents and teens. In our community, the saying is, we don't talk about what happens in our home outside of the home, right? And so, or something to that effect. And so that has been a big barrier. The fear of letting someone into the family, into the village, into the home is a real fear for parents and then the children.
You touch on a very good point. Children can be very cruel in terms of the way that they behave toward each other, even in a laughable way sometimes. And the stigmata of something like this, depression and anxiety, comes out in various ways. Have we seen any indicators that this is becoming a bigger problem for us now as it was pre-COVID?
I honestly can't say it's a bigger problem. The problem is being compounded and made more complex. Unfortunately, I being in the profession, and I know yourself as well, we know how big the problem already was. And so I can't say it was a bigger problem. It is just aggravated. The problem is now angry, and the top is completely blown off the problem, and we can't ignore it anymore. I think how cruel children can be in the bullying, and again the stigma around receiving resources. I actually experienced from my generation to my children's generation, and some of the gaps in between there, that this generation of children are ready to be more transparent, more vulnerable. They're ready to, talk more openly about their mental health, and I actually am seeing them do it.
That's interesting, because here it is, a new generation and new approaches to new problems. It's almost time for kids to go back to school. We've got a lot of opinions about what should happen before, during, and possibly after. But here again, in the mental health space, do we face, and I know we do, but what kind of challenges do you predict is going to come about with the return to in-person instruction and education? Are we really ready for this?
Honestly, we're not. We weren't ready for it when it all began. And we didn't take, again, that big pause that I'm saying we needed to take to really assess and address all the impacts to what we just kind of start doing. And so we still, the summer, we didn't take the summer, we didn't take any of the pauses that naturally occur in the educational system to really, again, look and assess from my perspective, from what I'm seeing and observing. And so, no, we're not ready. And so we're going to see with children is, increased depression, increased anxiety, and increased anger. They're going to start rebelling against this really uncomfortable, impossible situation.
We are victims of a lot of things in this society now. One of them, I think, is information overload, and we have to deal with the social media impact in all age groups. This age group in particularly, because they're more in tune to the technology than any other age group that we have to deal with. What should we be looking for in this population, and in the population in general, who continuously are bombarded by information, whether it's correct or not?
Absolutely. So we should be looking for anxiety. So information, and kind of being bombarded with information from so many directions, and conflicting information and controversial information and all the op-eds and opinion pieces. We should be looking for anxiety, increased anxiety, because that basically says I'm not processing very well the stimuli in my environment. So we should be looking for that, and we should be encouraging the children to engage with social media in very specific ways, and helping them to know kind of when to turn things off. If they're using it for socialization and connection, great. If they're using it to kind of do research and worry and, analyze things and figure things out, that may not be the best for children, because nothing's being filtered. They're getting way too much.
Patrice, during the Olympics, Simone Biles came out and did all of us a world of favor by admitting the pressure she was under, the depression that she was suffering. Would you comment on her position and how important that is to us as a society?
Absolutely. First, I want to thank her for her bravery and centering herself and her mental health, and really doing that advocacy work that I talk about that parents can do, but really anybody in a position of power and influence can do. So I just thank her so much for showing us her humanity and vulnerability in that way, because it was such a teachable moment for so many other people. And it really gave permission to all of us to really, check in with ourselves and say, hey, I can do something. I'm the greatest in the world at it, even, but should I? And what are the impacts, not just to my physical health, but to my mental health, emotional and spiritual well-being. And so that's really the comment. I would say that I am so excited about all the positive comments and the permission, again, that she was able to give to so many people. But I would caution people who are challenging her position and really shaming her or talking down on her, or even thinking it's a character flaw for her to have done this and is a weakness, because she may not see your comments and replies and opinion of it, but someone in your circle, in your life, your children, our children, are seeing you and hearing you talk about it. And so it's really robbing them of being able to do the same and having that autonomy over their own lives. So I would caution those kind of critiques.
I think she did the world a great
Absolutely.
service, and I was also very encouraged by the comments of support that she got from not only her fellow athletes, but from people in the industry here back at home. So we're very grateful to her. Patrice, we are out of time. We could do this for another hour, and we certainly will do it again. Thank you so much for being our guest today.
Thank you. Thank you so much for having me.
Our guest has been licensed mental health counselor Patrice Lucas. Keeping lines of communication open, being aware of the signs of depression and anxiety, and taking appropriate action when necessary are some of the most important things parents can do for their child's mental health. Thank you for watching. For Primary Care, I'm Dr. Lonnie Joe.